really wish women would become aware of the fact that changes in the vagina do occur. They're normal, but sometimes normal is not optimal.
Today we speak with Dr. Christine Derzko, who has helped many women navigate these sometimes uncomfortable changes, such as vaginal dryness, more comfortably.
We have not done a very good job in opening this whole topic up for women. 50, even 70% of menopausal women have vaginal dryness, and most of them do not address it. At least half of them never address the problem.
The overall health of your vagina is important regardless of your level of sexual activity. However, many people do not think about their genitals aside from specific reproductive or sexual health concerns.
These changes may start in the 40s, some in the 50s, some in the 60s. Estrogen levels tend to drop a bit, and the amount of secretion that they notice, normal healthy secretion from the vagina, decreases, and they notice some dryness. They may not notice it as just dryness, but they may notice some symptoms. So they may be more prone to vaginal infections. They may be more prone to bladder infections because of this problem. They may notice too much dryness with intercourse, that they really do need to use a lubricant. They may just find that there are times during the month when there's so little lubrication there that they're dry and they may need to use a moisturizer in the vagina. So it may come anytime, and it's quite subtle. So it's important to tell women, hey, this is normal. This is just one of these things. Like when you were a little girl before you started your periods, you couldn't figure out why there was all that stuff coming out. It was so moist and so much of it. Well, now at the other end of reproductive life, there's a little less of it.
The good news is that there are treatments to relieve this discomfort.
If a woman is talking about having dryness and pain with intercourse, of course, we have lubricants that are there. They're fairly short acting, need to be repeated. You have sex more than once in a short period of time. Again, be careful to make sure it's in the normal pH range, because otherwise it can be very irritating to the tissues. Moisturizers are important. Just because you're walking around, you notice you're a little drier. So there are various moisturizers we can use. Simple products too, things like hyaluronic acid even, will work quite nicely there. Then we have problems we're dealing with all the issues that are a result of real estrogen, severe estrogen deficiency, which may be the bladder irritation, urinary frequency, urinary tract infections, incontinence sometimes, vaginal dryness that is so profound that it may even lead to bleeding. For those, we really need to treat the vagina. Without question, hormones are best when they can be used, and when that's not a possibility, then looking to something else like a hyaluronic acid product can also give us a treatment for that.
There are helpful non-medicinal therapies women can try, such as water-based vaginal lubricants and moisturizers, which are available over the counter at any drugstore. One option is Fem Revive for vaginal dryness, which uses natural ingredients and is paraben-free. Ingredients such as sodium hyaluronate, aloe vera, and lactic acid help moisturize and maintain a balanced pH, thereby hindering the activation of harmful bacteria and preventing infections. Each applicator is pre-filled and individually wrapped to avoid secondary infection. While we might feel embarrassed to talk about vaginal health, ignoring potential issues won't make them go away.
We must get women to talk about this. And we must teach them what the signs are. We must reassure them that we have treatments for it. And we as physicians have to make them comfortable enough to allow them to open up and discuss it with us.
Women concerned with their symptoms should always consult their healthcare professional.